Alrighty. So today's workshop is on the PhenX COVID-19 project and research collection. Just some general housekeeping rules. Just so you're aware, this meeting is being recorded. We appreciate that you mute your microphone if you're not speaking to avoid any background noise. And as mentioned, if there's anything that you have questions on while I'm speaking, feel free to use the chat feature. So the goals for today's workshop is to learn the history of the COVID-19 project and also learn about the resources that PhenX offers related to COVID-19. So this includes the research collection, our protocol library, and the variable compare tool. I will be primarily focusing on the research collection, but quickly also glance over the two others. So first, a little bit of background. If you're not familiar with PhenX or haven't attended one of our previous webinars, so PhenX stands for Consensus Measures for Phenotypes and Exposures. And really the goal of this project, which has been in existence for over 15 years, is providing the scientific community standard measurement protocols. So this is really driven by input from those that are the experts in their related fields. And we also have a steering committee that provides the overall guidance, as well as the working groups and content expert panels. We also engage in community outreach to get input from the community. So really the content of the PhenX Toolkit is driven by what is available throughout the community and essentially providing peer input. As you can see, we've been funded by a variety of NIH institutes over the years. Currently, we are funded by NHGRI, the National Human Genome Research Institute, and our project scientist is Jyoti Dayal. Just to clarify what PhenX is and isn't. So PhenX provides the measurement protocols. So that means the questionnaires, the surveys, how to measure information, that type of data is what we provide. And this is all gathered together by this consensus process. The website is accessible. You can freely browse it. There is no required login, but you're welcome to create an account at the website. And so as a result, PhenX is not, we don't store data, we don't collect data. What the information we provide isn't new methods, and it's not proprietary. So the protocols, as if they're marked as such, are freely available to use, but we just appreciate some citation, which I'll go to in later. So why do we want to use standard measurement protocols? Because if all these studies are obviously collecting data about very similar topic areas, and we want ideally, we want studies to be collecting them in the same way. Because how you'll find trends, how you'll find new insights into data is by actually combining them. The larger the data pool, the more likely you'll find some sort of statistical trend. And so if they're collected the same way, then it's easier to combine that data. And then as a result, it's easier then to find some information and some results from combining that data. And for PhenX itself, we do like to emphasize that we do want clearly defined protocols, that they've been validated and used before, and that they're easily reproducible and low burden. And also, we want protocols that are relevant to what's of interest in the research community. So a few PhenX definitions to go over before I move on. So PhenX consists of domains and collections. And at this level, those are your larger topic areas like demographics or cancer. Within each of those subsets, then there are what we have protocols, which, as mentioned before, are the standard ways of collecting data. For each protocol, we provide Word document versions of that protocol itself, or data dictionaries, which are Excel or CSV versions, to easily then integrate that into your study. And I will be showing examples of that later on. So first off, before I move on, are there any questions about PhenX itself? Alrighty. So we will move on to the history. First of all, some history of the COVID-19 project. So this began back in April 2020, only about a month after the pandemic was officially declared and everything started locking down, where the PhenX team met with NHGRI and the Office of Director OBSSR to discuss how our project could contribute to the NIH response to COVID. They had put out a larger request for focus on COVID-19 research, not surprising given the state at the time. And just to note, though, this was obviously very early in the pandemic. Little was known about COVID-19, but we want to provide some sort of resource that could help in ways of collecting information about COVID-19 in a standardized manner. So as a result of these initial efforts, we first created a library of COVID-19 related instruments. And this was in collaboration with DR2, which is the NIH Public Health Emergency and Disaster Release Response. And we also created a COVID-19 research collection in the Toolkit. And I will explain both of those shortly. So what is the library itself? So the library, if you look at the little graphics on the left-hand side of your screen, all these protocols or surveys or questionnaires, they were coming in from different sources, around the world, from around the United States, from large organizations and large studies like CDC, WHO, World Health Organization, and from large studies such as ECHO. And they were creating these protocols in rapid manners to try to address the matters related to COVID-19. So those were all coming in, and DR2 was collecting them so they could see what instruments were being created and kind of get a gathering as to what topics were key and what studies were focusing on. DR2 then delivered them to PhenX, and we ended up creating a separate part of the PhenX Toolkit website, which we termed as the PhenX COVID-19 Library. And we basically posted those into the library. So they're PDF, most of them are PDF formats of these questionnaires and surveys. So then the COVID-19 library, so what it contains are these PDF versions, which we call full instruments. And each of those PDF versions, where applicable, we would break them down into subsections. So say a PDF contained, health history and then symptoms of COVID, and then schooling, effects on how schooling was happening. We would then break those down into modules where one module would be the health history and our module would be the COVID-19 symptoms and our module would be related to the school effects. So those are basically what are in the COVID-19 library. So then when we were creating a COVID-19 research collection, we wanted to focus on key topic areas of the COVID-19 pandemic. So we end up taking select modules from the COVID-19 library. And in discussion with the steering committee, we then selected a number of them, created different sub-collections of them within the COVID-19 research collection based on topic, and also used additional protocols that were already in the toolkit, and we ended up creating the COVID-19 research collection. So just as mentioned, we had two releases of the COVID research collection. The first release was the major release that contains 6 specialty collections, which I'll show later on. And these contain 20 new protocols back in fall of 2020. Our second release was 27 new protocols in March 2023, and those were primarily focused on long COVID. All right, so I will be stopping here for briefly. Are there any questions before I go into a live demonstration? All right, so I'm going to switch screens. All right. So here I am showing the PhenX Toolkit homepage. This can be accessed by going to www.phenxtoolkit.org. And you can see here that there are multiple ways of navigating to the content of the PhenX Toolkit. So first off, there are two ways of accessing the PhenX of the COVID-19 research collection. One way is at the very top, there's a COVID-19 section, and under there we have the COVID-19 research collection, as well as our other two COVID-19 related resources. The other way of accessing the COVID-19 research collection is by clicking this collections button. And there you can see a list of all the collections that we have available in the PhenX Toolkit, which includes the COVID-19 research collection. So I will click on this. And you can see here that we have a landing page for the COVID-19 research collection. We have a couple of pages explaining the history and the content about the COVID-19 research collection, which I'm not going to show you, but it's there for your reading on your own time. And then we also have the specialty collections listed below. So I'm not going to go through each of these specialty collections, but I will just give a brief overview. So we have a behavior and risks collection, which is focused on how people, what precautions perhaps people were taking during the pandemic, any other everyday behaviors, such as maybe related to drinking habits or smoking habits. We then have ethnicity, race, and demographics, which is just general information about the people themselves. We have history, treatment, and outcomes, which is focused on, health history, any treatments that they had received, and what were the outcomes of these treatments. We then have information resources. So where were people looking towards to get information about COVID-19? We then have psychosocial and mental health. So how were people, how was their mental state during the COVID-19 pandemic? Was their living situation or their work situation, was it somehow impacting how they were feeling? We then have socioeconomic, which was focused on, did the COVID-19 pandemic have effect on, their job security, their income? And then finally, we have the long COVID, which is focused on the longer term effects for those that were infected by COVID-19, and were there any lingering symptoms that they continue to experience. I also want to note too that we also have a recommended collection. This is at the suggestion of our steering committee. And this is complementary and could provide additional assets if you're collecting and running a study related to COVID-19. So I'm going to go into an example for this. So you could see here, this is upon clicking one of the specialty collections, you'll see a variety of content here. Just to note here on the left side, if you wish to switch which collection you're viewing, you don't have to hit the back button. You can simply scroll to a different one here on the left-hand side. We then have information. We have the list of protocols that are part of that collection. And you can see here that, as I mentioned, some of these are coming from protocols that were already in the toolkit from other research domains, such as body mass index or substance lifetime use. And then we also have the new COVID-19 protocols that were added as part of this project as well, such as social distancing experiences or social interactions. You can also see as well how these protocols are broken down and which original domain and collection that they are a part of. So I am going to go and view one specifically. So this is this is the information you'd view for a single protocol. Over here on the left-hand side, you will see related protocols. So not surprisingly, social networks and social isolation are related to the COVID-19 related social interactions. And also we have essential protocols, which are protocols where the data collected is needed in order to fully understand the data that you would collect from running this protocol. Each tab contains information about the protocol for you to better understand its history and how to run the protocol. So the first tab contains protocol information itself, such as the description. So this is a survey to understand how COVID-19 has impacted people's lives, specifically social interaction. The availability, it's saying it's free to use, so you don't have to require permission in order to use it. And then you have the protocol itself, which you can see these are questions asking about how you feel about different aspects, prior and before and after the COVID-19 pandemic. Under the administration tab, we have if there's any sort of specific requirements that are needed or training in order to conduct the protocol, as well as any major equipment that may be needed, or if the protocol is really long. In this case, this is not an example of one. And we also provide information, metadata about how it's administered. So this is self-administered, so someone just takes it on their own. The life stages that it covers, and the participants, so who the original protocol, the study population. We also have additional information, such as what language it's available in, and also the original source. So the original source was coping with COVID-19, and the source came from University of Florida Institute on Aging, Department of Aging. We also have some higher level metadata about this protocol, including when it was released, some definitions. So this is a 12-item self-report questionnaire, and what's purpose, and any keywords that are associated with this protocol. I also want to note too that we encourage folks to cite usage of PhenX protocols when they integrate them as part of their studies. So if you click on this link, you are provided a way to directly link to this webpage to include within your citations. If you click on that, that just copies this information right here. But we also encourage you to cite the original source to give proper due diligence. We also provide downloads of the protocol in a variety of formats. So you can download those questions as a PDF file or as a Word file. And then also you can download them as data dictionaries. So this will assist then in actually collecting the data. So I'm going to just show an example of the DCW in Word, which is data collection worksheet, and data dictionary in CSV format. So if you check those two and download them, let me reshare my screen. So you'll see in downloads that there is a zip file that will download. I'm on a Mac, so it automatically unzips the file. But if you were to go inside that folder, then you see the two types of files that you did download. So viewing the data collection worksheet. Let's also click that open too. So you could see here with the data collection worksheet that this is a Word file, and you can see the same questions that you saw on the website. And this is just the way that if you want to be able to print this out and distribute them, this is one way of utilizing the protocol in your own study. And then also here is the data dictionary. And what you can see here is this is a slightly more granular way of viewing the content of the questionnaire or protocol itself. So each question essentially is getting its own variable. Now, the variable name, this is just a PhenX specific identifier. Our variable description, as you can see, is the actual question itself. We just have additional metadata about, the original document it's coming from, the data type, in this case, it's enumerated, the source and PhenX specific variable identifiers. And then also in this case, the values or the answer choices to each of the questions. So, the first so many questions, the answer options are hardly ever, some of the time and often. And for the other questions, the answer choices are strongly disagree, disagree neutral, agree, and strongly agree. So this is another format that can be helpful in collecting the data and utilizing it into your own study. So before I move on, are there any questions related to what I just showed? All right. So as noted, these collections are obviously specific to certain topic areas related to the COVID-19 pandemic. And then also through the process of building these research collections, we selected specific protocols from certain sources to add as part of these collections. But, perhaps this is not fully covering, or it doesn't quite, you're not quite finding what you're interested in integrating into your study. And while these are recommended, we recognize too that we can't cover everything about the COVID-19 pandemic within these research collections. So if you come to that, this is where we can suggest that you browse the COVID-19 protocol library. And while I'm not going to go into depth into this, when coming to the protocol 19 library, you can see that there are a lot more instruments that can be found here. There are 185 full instruments, and most of these instruments also have modules as well. And just generally, overall, what we provide here is the original source of where these instruments are coming from, the name of that source, and if you were to click on this, you would open the PDF file. And also we provide general subtopics, so you can have a quick view as to the type of content that's being covered in these protocols. In cases where there are modules, there'll be an expansive view modules and subtopics, and you can click that and you could see the modules that belong to the full instrument. And you can download each of these as well as PDF files. And then we also have a variable compare tool, which I'm not going to go into today, but this is a way of looking at, seeing how, a quick glance at possibly how much overlap there may be across COVID-19 instruments. Not surprising that back at that time, COVID-19 instruments, surveys, various data collections were being created at a rapid pace. And the whole idea of this project was to avoid having too much duplication and trying to provide sources so people could know that they were out there and didn't replicate them. But so what we did as a pilot to just see out of curiosity, to see how much overlap, we selected some protocols from the COVID-19 library and ran an analysis to see how much overlap there was. And the tool provides some functions to kind of browse the results of this pilot study. All right.